Hi, I'm Dr. Alan Mendelsohn from Eye Surgeons and Consultants in Hollywood, Florida. Today I'd like to talk about corneal abrasions. The cornea is the clear dome over the eye. The cornea actually is very similar to a watch crystal over a watch. The cornea itself is nice and clear so that the light rays will go through the clear cornea into the eye and back to the retina to hopefully give us good, crisp, sharp, clear vision. Sometimes, unfortunately, a scratch or scrape can happen to the cornea. That's referred to as a corneal abrasion. So let's pretend that this little piece of paper is representative of a corneal abrasion. So the cornea itself, being the clear dome over the eye, it actually has 5 separate layers. Of the 5 layers, the most superficial layer of all is called the epithelium. So what happens is with the corneal abrasion, a chunk of that epithelium is scraped off. If the epithelium is scraped off, between the epithelium and the layer beneath it, there are nerve fibers. In fact, there are more nerve fibers per square inch than any other part of the body. So let's pretend this area where it's yellow, that there's a corneal abrasion where the epithelium has been scraped off. So what happens is because of the raw exposed nerve fibers, people will complain that it feels like a knife or needle is jabbing them in the eye. Knife going in the eye, out, in, out. So there's usually tremendous pain, achiness, tearing, sensitivity to light, and the eye really hurts pretty considerably. So when does this happen? The most common cause of corneal abrasions from my experience are with contact lenses, insertion and removal, and I've found that it tends to be a little bit more common in newer contact lens patients, but also those who have longer fingernails, where accidentally a fingernail, a thumbnail, just gently cutting the cornea, either with insertion or removal. There are other sources, of course. Something flying into the eye can cause an abrasion. But an interesting thing that most people don't think of is when one is holding a child, the little youngster frequently, lovingly, will just kind of put their face, or come up close, but put their little fingers in your face, and sometimes their little fingernails can scratch the eye. So even though they might be just several months old, or a year old, or 2 years old, that little scratch is a very big deal. So if you have a scratch of this size, the eye hurts considerably. So what happens? When there's a corneal abrasion, again, generally there's quite a bit of pain. The eye knows what to do. It sends cells to grow in so the epithelium heals over. The problem is every time your eyelids blink, they act like fly swatters knocking out the cells so that this corneal abrasion does not heal at all, or sometimes it will heal, but it heals poorly, leading to problems down the road called corneal recurrent erosions. In order to get a very good, well-healed corneal surface with good quality of vision, we put what's called a therapeutic bandage contact lens. It's a contact lens, it's kind of like a Band-Aid, that if we have a cut where we put a Band-Aid, it's a clear lens, kind of like a Band-Aid that we put over the eye. The reason for the contact is twofold. First of all, by having that clear bandage over the eye, every time the eyelids blink on top of the bandage, the road paving crew underneath the bandage lens is doing their job, getting this to heal as fast as possible. The second reason to have a bandage covering the eye is because that area, besides the epithelium making the eye comfortable, when it's gone or scraped off for like an abrasion, that raw exposed area also is at high risk. That if someone were to be coughing, sneezing, and it gets into places where the epithelium covers the eye, it's an excellent barrier. But where there's the abrasion, the eye is at high risk to get a corneal ulcer, and a corneal ulcer could be devastating. So another reason for the bandage contact lens, it prevents microorganisms from getting right into that area. Now, even though we use a bandage lens, we will still use antibiotic drops, frequently anti-inflammatory as well. Sometimes we use combination drops that have them both. So with that bandage lens in place, we'll reevaluate 24, 48 hours later, depending, and very, very rapidly, the epithelium will totally heal. Once the epithelium is 100% intact, we no longer need the bandage lens. Also, we can stop the antibiotic eye drops. But the goal is to have a 100% healing, where it's a good quality healing so that area doesn't cause trouble later, so there's no scar tissue, and again, to prevent an infection. So corneal abrasions, unfortunately, are very common. In my practice, I will see patients with corneal abrasions 2, 3, 4 times a day, every day. But the key is to have them taken care of promptly so as to prevent worse problems such as a corneal ulcer. If you want more information, if you go to our website, www.myeyesurgeons.com, if you go specifically under the column called Our Services and look at cornea, you can have a lot more information about cornea, corneal abrasions, corneal ulcers, and other related eye conditions. Thank you very much.